everyone had a chance to take a great break, a little walk around, and get a drink of water. Our next session is entitled Navigating Life with a Chronic Disease. And we've brought together a wonderful group of thoughtful voices who will share both personal as well as professional insights into living well with chronic illness. We're going to try and cover a whole lot of different topics here. Really what supportive care really means, the value of starting palliative care early. We're going to explore some of the emotional, psychological, and practical realities of managing life with chronic illness, the impact on caregivers, and how to advocate and get the kind of support that you think you need. I think this will be a very comforting and clarifying session for many. So with that, I'd like to introduce the wonderful voices that we have today. First is Dr. Brufney Hannon, who leads the palliative care program at the Princess Margaret Cancer Centre in Toronto. She is also an associate professor in the Division of Palliative Medicine at the University of Toronto. She's very passionate about promoting early palliative care. We're going to spend quite a bit of time talking about that for patients with advanced cancer and their families. Dr. Hannah Nette is the family physician and the director of clinical services at Inspire Health Supportive Cancer Care, which is a nonprofit organization offering free supportive care to cancer patients and their loved ones. I'm very happy to welcome back Jason Abramovich, who has been a wonderful contributor to colorectal cancer community conferences for many years. He's also been a conference co-chair. I think, Jason, this is the second time you've done this for us, which we're always very, very appreciative of. Jason is an early age onset colon cancer survivor who received his diagnosis and underwent treatments in Ottawa, actually amidst the COVID-19 pandemic in November 2020. Jay is also a very strong advocate for men and male caregivers who are experiencing cancer, and he does that through the organization Man Up for Cancer. And last, we had the privilege last year and are thrilled to welcome again Lisa Levy, who's told us about her amazing good news as we were chatting quietly behind the good scenes, and she's going to share that with you today. She was diagnosed with stage 4 colorectal cancer in March of 2022. So I'm going to start this session off actually with Dr. Hannon, who really will provide, I think, a very new and fresh perspective on what the word palliative means and how it is more than what we think it might be, and how we need to do this earlier in our process than afterwards. So welcome, Dr. Hannon.
Thank you, Anne-Marie, and fellow panelists. Thanks so much for the opportunity to participate in this incredible event. It's always such a thrill and a privilege to get to work with groups like this and to beat the drum for early palliative care. So I'm really grateful for the opportunity. You know, as much as we like to talk about early palliative care, there's still so much anxiety and stress and, dare I say, stigma around the word or the term palliative care itself. And my goal in this session is to hope maybe demystify or destigmatize some of that for your group today. And, you know, many people, when they think about palliative care, they think about the very end of one's life, right? And they have ideas that it's when somebody is bedbound or very gravely ill, or where they're no longer having treatment for their cancer. But what we have known for a long time in the palliative care field and have started to really demonstrate through our research and our advocacy work is that we as a palliative care community have a skill set that is relevant to patients and their families so much earlier in the journey through cancer. We manage symptoms, we provide holistic support physically, emotionally for patients, their families, and their loved ones. And who doesn't do that, right? When they're going through cancer, it shouldn't be at the very end of one's life that we start to pay attention to these things. Yes, our role does extend to the end of life for those people who need us, and we have a skill set in supporting patients and families right through the end of life and into grief and bereavement. But there's been a lot of really powerful research over the past decade that has shown us that when palliative care teams meet patients and their families early, often at the time of diagnosis of advanced cancer, we can improve their quality of life, we can improve their satisfaction with care, we can improve their symptom experience, and we can help patients actually live longer, which is kind of a mind-blowing statement to say, because it really turns on its head the preconceptions that palliative care is only for patients who are at the end of their life. And so what I say to patients and families all the time is, my job is to help you live as well as you can for as long as you can, regardless of where you are in your cancer experience. And that's really what I think palliative care is now. It's a holistic part of everybody's cancer experience right from the very beginning. And it's a service just like your medical oncologist, your family physician, your radiation oncologist. We're another level of support, part of the team of professionals looking after patients.
Thank you so much for that. Dr. Nettie, this feels like a new idea in cancer, because for so long, it's been associated with end of life. Is this new? Why is it new? And how should people think about it from your perspective?
I certainly think it has really, we've seen this becoming more and more part of the conversation in the last decade, which I am incredibly pleased with and honored to be here with all of you today. So thank you for this this really incredible invitation to be on this this panel and having this really important dialogue. So Inspire Health was founded by two, I would call them pioneering physicians almost 30 years ago, who really saw a need for exactly what Dr. Hannon was talking about, which is that whole person approach to caring for someone journeying through cancer. So that's taking into account, that physical health, the mental health, that spiritual health, social health. So really looking at that holistic approach to care and thinking about it throughout that cancer journey, being a relevant piece of living well through cancer. And one of the reasons and the hopes that I have for all of us is that we see this coming more into mainstream care. And I think part and parcel with that is that folks are thanks to the evolution in treatments and survivorship, folks are living better and longer with cancer than we've seen before. So that and there's been a real shift to how can we support people who are, now living far longer than decades ago with advanced cancer, and really talking about that focus on living. So when we think even just about our language around supporting folks, supportive care, I've seen being embraced more and more by our community, by our healthcare system. In fact, at BC Cancer, which is the provincial provider of cancer care in British Columbia, where I'm based, the pain and symptom management team was named as such versus palliative care, to really talk about how there is something for everyone there. And as Dr. Hannon mentioned, I don't know that I've ever met somebody who doesn't need that holistic and benefit from that holistic support to their health going through cancer.
I find that personally extraordinary, because palliative actually is almost a negative interpretation, end of life. To reframe it to living, to reframe it to supportive care is really an extraordinary shift, I think, in driving a different kind of mindset around how one looks after themselves. Thank you for sharing that. Lisa, I mean, first of all, I think it would be very helpful for our audience to understand a little bit more about your story, because you shared such good news with us, or you wanted to share good news with us in the context of what it means in this conversation, really living well with cancer too, and referencing in on some of the palliative conversations you may have had.
Absolutely. Thanks again for having me. In 2022, when I was first diagnosed and they realized that it was a stage 4, I was expecting to have 12 rounds of chemotherapy, some surgery, and then everything was unknown. And it was when I had my, let's say, 15th round of chemotherapy that I learned about this concept of palliative care and maintenance therapy. And basically was told, we're going to keep you on chemotherapy until it stops working. And that was really, really a scary thing to hear. When this idea that Dr. Nettie just brought up about how you can call it not palliative care for end of life, but like continuing and just pain management and things like that. That was really wonderful. That's really wonderful. And I wish that we had that here in Quebec as well. But just to let you know, after 2 years of chemotherapy, I was at the end of my rope, and I was honestly just about to ask if I could cash in my life insurance early and find homes for my birds. And really, I was just trying to plan for the end of life, even though I was still functioning. I just wanted to sort of get my things in order. And my doctor let me know, no, we're going to send you over to a liver specialist because we think that you might qualify for a transplant. So that's the good news, is that I spent a year being assessed, and after about a year of that, so now here we are in 2025, and it looks like I'll be eligible to get a liver transplant.
Mm-hmm.
Which is incredible.
That is incredible. Congratulations on that. So in terms of, what might you want to, being in this wonderful place a year later, share with our audience in terms of what it means to live well with a chronic disease? What is a big insight you could share with everybody?
I believe that this idea of maintenance therapy, for those who aren't eligible for that sort of major surgical intervention, the idea of maintenance therapy being and treating a chronic illness, I think that really changed my mindset when I started thinking of cancer as not something terminal, but as just a chronic illness that you just have to manage. It's helpful for your mindset. It's helpful to just remember, yes, I need treatments every 2 or 3 or 4 weeks, however it's set up, and that you just have to work around it, and that you know in advance that you're going to have ups and downs with how you feel, but knowing that you can manage it, and especially with a really good team to handle your side effects and your psychological side effects. In my case, it was skin condition. I had terrible skin problems, and seeing dermatology really helped. And speaking with my team about how to get more active and diet, and it really, really helps to have that team manage it with you as a chronic condition.
Thank you for sharing all of that. And I want to come back to the concept of team, but I want to bring Jason into the conversation because Jason's always ahead of the curve on many of these things. Jason, just your perspective on this switch from palliative into supportive care, how people from a mindset perspective can take hope out of this shift, I think that's happening.
Yeah, no, absolutely. First of all, just thanks for having me again. I absolutely love to do these and help out. And
We love having you.
Yeah, I meet all these wonderful doctors and folks that are supporting us and sharing just new info and insights. Lisa, congratulations on the transplant. That's amazing. I guess for me, so I had a bit of a unique experience because my medical oncologist, was always quite actually supportive and very into the like pain management, and like he kind of like walked a little bit of that line of palliative care without actually being a palliative care doctor, which was amazing. So what I do remember though is, and I think it's worth mentioning because this is about 5 years ago now, when I had my first meeting with him, and he brought up palliative care. I still remember that feeling of, oh my gosh, I'm dying. Like as soon as he said that word, like after a whole bunch of like, oh, the odds are great. I think you're young, you're healthy, you're strong. We're going to get you through this. As soon as it shifted to like that palliative care word, I was like, oh my gosh, what do you mean? You just told me ABC that was, sounded pretty positive, and now we're talking about palliative care. And when he actually explained it, that was new to me. Like, I never realized that. And I know that's a very common misconception that a lot of patients have, and a lot of friends that I have, a lot of people that I talk to, whether it's, connections that I've made or peer support wise in the community. There's this like, as soon as you talk about palliative care, is this like dark cloud that comes over everything, and nobody wants anything to do with it. Um, and I honestly think, like, from the amount of time I've been in this space, I think it's very much like an education piece, not from like the doctor standpoint, but just the system in general. Like when cancer patients come into the system, there just has to be a bit of a shift in regards to maybe the wording. Like that whole supportive care is quite amazing. Like I know in Ottawa, we have like a pain and symptom management clinic. It's not called palliative care. So very similar type of wording. But from my experience, like I like to share that like my medical team absolutely saved me. Um, but all my like palliative folks and my like alternative supportive therapies and all that type of stuff, those folks were the ones that like gave me my life back, right? And allowed me to kind of like keep a very high quality of life even during treatments, right? Like I was able to continue working all the way through chemotherapy, and I was able to exercise quite a bit, and I kind of fared fairly well. I feel guilty saying that sometimes. Um, but I did a lot of work along with a lot of my team to help, to help that happen. So I definitely think once you're open to it and you understand that that team and that concept is actually there to help you and actually make you feel better, because, your oncologist, unfortunately, the reality is they don't have that time, right? You're lucky if you get to sit with them for more than 10 minutes when you go in. So to have a whole team focused on just like your well-being, I think is super, yeah, it's important, right? I think that's a crucial part to the journey, regardless stage, outcome, what the trajectory is. Um, I've seen some folks, with really short trajectories have incredible like quality of life for the last couple of months, like just because they had a team specifically to support that, right?
Yeah.
And also the other end, like me, is they allowed me to actually get back to like a very normal life, right? Post cancer, which is really nice.
Yeah, thank you so much, Jason. And I think it's a great bridge between what you and Lisa have said is this concept of the team. And so if I've just been diagnosed and I've got a lot of information coming at me, medically, as well as emotionally, et cetera, et cetera, et cetera, it's a lot. So from a system perspective, Dr. Nettie, Dr. Hannah, is what should people be asking for to ensure that this trajectory around supportive care is in place and that they're not stumbling into it? What kind of things exist today in certain environments? And if it doesn't exist, what should people be asking for? Dr. Nettie, do you want to start?
Okay, certainly.
I can see you bursting at the seams.
I just didn't want to interrupt. I'm happy to start. So I mean, as you just described, Emery, what we hear all the time is just how all encompassing and overwhelming, especially some of those initial days, those initial weeks can be. And I think it like if I think about how supportive care, and by that I mean that really wraparound care while people are navigating through, and particularly in those early stages, the role that supportive care can play, I think it's always incredibly important. And it can be, it can have kind of a different focus at different stages. So one of the focuses that I see that supportive care can be a game changer is in helping people to really feel that they have, that they're able to build that supportive team, and can get some empowering information to help them feel, kind of that like ready to be able to make their best decisions, to be able to feel as informed and as knowledgeable as they need to feel. And so what that looks like can be different for different folks. For some people, being able to connect with, say, whether it's a knowledgeable family doctor in the weeks between, or sometimes it's longer than weeks, between when they get their diagnosis and when they, or say seeing a surgeon or seeing an oncologist. Sometimes that can be in a particularly difficult time. And so, if they have a family doctor that they can connect with, or the Inspire Health physicians, I'm one of them. That's a really important time when we can really help to decipher information, support them to better understand, what's happening, what supports are available, what decisions they might be facing, and really help them to feel as empowered as possible with information, and also connect them to other supports depending on what's going on. Sometimes there's other symptoms that are really playing out, or maybe every time they walk into the kitchen to eat a meal, they have waves of huge amounts of stress because there could be a lot of worry, a lot of questions, a lot of confusing information that or conflicting information that's maybe coming at them. So depending on what's going on for them, maybe they're having challenging sleeping. So it really needs to meet the person where they're at. And as I say, that can look different for different people, but that period of time, that very often overwhelming period of time, is, I think, where supportive care that's available right from the moment of diagnosis can be crucial, and connecting folks with that. So that's one of the challenges as a nonprofit organization, is how do we get that awareness out there so that people can get connected to some of those resources that are available to them at the time that they need them. So that's why opportunities to have these national conversations, to let people know what's out there and what's available to them, are so critical.
Yeah. Thank you for saying that. And it's a wonderful opportunity for me to say this is the vision and mission of Colorectal Cancer Canada, is to get this kind of information to people in a very timely way. Dr. Hannon, it seems to me though that you've just been diagnosed, or you're living with a chronic illness. This concept of setting up a team, accessing a team, who does that? And it's not available to everybody. So does that mean the family is responsible for doing that? How does that execute itself?
Such a great question. And I wish I could say that, the same services exist throughout the country and in different areas, but right now they don't. And so you have the ideal model, which is this early wraparound care, like Dr. Nette described, that happens right from the time somebody is diagnosed, and is a team of experts in pain management, symptom management, physical and emotional supports for patients and families, as well as more practical supports like nutritionists, social workers, psychologists, those sorts of things. But we know that resources like that don't exist in every hospital, in every community, in every center around the country, and that they are very much, often tethered to the larger academic centers that have more resources and more supports. That's not to say that patients who are receiving care elsewhere can't and shouldn't avail of these services. They must, but it's often set up in a different way. I mean, Jay gave a great example of his oncologist being quite skilled in doing their own palliative care. And we're seeing that more and more now, that oncologists in training are spending time with palliative care teams and learning how to manage common symptoms that their patients experience themselves, if they're able to, or nursing colleagues doing some of that wraparound training too, or outreach teams like ours who can go into clinics and see patients who are needing support in the moment from their oncologist if there's a pain crisis or there's an urgent issue. But it's also things like family physicians, as Dr. Nette said. I think sometimes family physicians get overlooked in this conversation because, you know, when you get a cancer diagnosis, all of your care is centered in the hospital and tests and blood work and CT scans, and your poor family physician gets a little bit marginalized. But many family physicians are willing and able and very keen to support their patients and their families through this journey too. And again, there's a lot of training and support for family physicians now and their care teams in the community to learn some of those basic skills and to support patients who don't have extraordinary needs. And so we have a sort of a pyramid of access that we talk about, where the bottom of the pyramid, the white part, the wide part, are the core palliative care skills that or supportive care skills that every healthcare professional should have. You know, how do we assess symptoms? How do we talk to patients about what they're going through? How do we figure out what their needs are? And that can be everybody from the person who checks you into your appointment to the nurse who takes your blood pressure to your oncologist. The middle layer is more specialist level, like what Jay was talking about, where you have a specialist physician who has expertise in their type of cancer and the types of needs that patients will experience commonly in relation to that. And then the top of the pyramid are patients and families with very complex symptoms who really need that really top tier level of specialist support that's provided by experts like our team. And of course, you know, depending on where you are in your illness, you might sort of, you know, fluctuate between these levels of support. But a lot of it is, you know, how do we get the message across, as we've heard from others on the panel today? How do we demystify the idea of palliative care? How do we build palliative care into everybody's business? And how do we educate the general public that this is something, and the cancer community, as we're doing here today, that this is something they can ask for too? More and more I've had patients who come to my clinic and they say, I asked for this because I read about this, or I did my research and I've seen that. And that's a very legitimate way to access support too, if you don't feel you're getting it organically in your organization, is to ask.
Yeah. Speak up.
Mm-hmm.
Ask. Lisa, can you talk, I mean, again, there's an extraordinary number of support services available, but everybody needs something different at a different point in time. And talk to us a little bit about what you needed when and how you got what you needed. And it would be, I think, very helpful to inform other people's journeys around what they need and who they need to speak to and when.
Exactly. Well, when you're first diagnosed, obviously you want to know what the treatment plan will be. So that would be your oncologist that you speak to at the beginning. But then it sort of morphs into the experience of actually having the treatments. And that's where talking to other patients really can help, because their strategies might help you. It might be totally different, of course, and sometimes you can get bad information. So critical thinking is key. But knowing that other people went through things like loss of appetite or lack of energy, or I have no idea how Jason continued to go to work through his experience. That I want to hear more about, because in my case, I was not able to. But at the beginning, it's basically, what's your treatment plan going to be? And then what's it going to look like as you navigate that? When it becomes the chronic illness, and I really like calling it chronic illness, like dealing with asthma or diabetes, it's just something you have to deal with. At that point, you kind of want to see other people's success stories. You want to see the people who have been thriving, and you want to hear about how, yeah, sure, they've had stage 4 cancer for 9 years or 20 years. And that really makes you hopeful, because at the beginning, you can't relate to that at all. You just immediately think, okay, that's it. I'm very sick. But hearing other people's stories is so helpful, and hearing how they navigate it. And that's what I think is useful as it becomes a chronic illness.
Mm-hmm. Thank you for sharing that so openly and honestly. Jason, you have been extraordinary around forging ahead and trying to keep your life as normal as possible. I know that about you. Can you talk to us about how you did that? How you reached out for what you needed when you needed it?
Yeah, well, it's definitely a bit of a loaded question, because there's an aspect to that where I don't really know. I kind of just did it. But the stuff that I do, that I could explain, was very early on. I knew community was a really important thing, right? Like I I was very lucky that I fell into the hands of an incredible medical team. I trust all of them. They've done phenomenal work for me. I've never really had to fight or question or do anything in regards to that. We definitely work as like a collaborative team, which is huge. And I know a lot of patients unfortunately don't get that. So a lot of my focus really turned to really educating myself about the diagnosis, right? So I wanted to learn as much as I could about colon cancer as possible. Because obviously, you know, after working with in those early days, that fear, right, and the panic and all of that really subsides a little bit when you start to understand a little bit about what you've been diagnosed with, right? So it's not so unknown. You get a little bit familiar with it. And so I found that was very empowering for me to really understand what I had. Um, you know, learn about the treatments, learn about, and by no means am I saying like become an expert, but just understanding it, right? Because a lot of patients, you know, like even to today, like I meet a lot of patients through like peer support work where you're like, oh, what's your diagnosis? And they're like, oh, I don't know. It could be a this or that, or I'm not really sure what treatment I'm on, but it sucks, right? And which is fair, but like I think one of the ways that I really excelled early on was again like really surrounding myself with community. Very much like Lisa said, like being able to say like, you know, I have my first chemo coming up. I'm absolutely terrified. Someone tell me about it, right? And I was, you know, I was fortunate enough to have people say, well, you're going to go in. The nurses are going to do this. They're going to say that. You're going to see this. This is going to happen. And it almost like it takes a lot of that unknown away. Not that it wasn't scary, but it gives you a little bit of an like behind the curtain a little bit, right? There's not so many unknowns, which for me I felt really lessened anxiety throughout the last 5 years about a lot of different things. But this might not, I mean, this might not be a very like popular comment, but I've never really said things that everybody totally agrees with. But for me, I find what was one of the biggest successes for me is I had to learn how to be a patient and learn how to be part of my team and not just sitting there doing what everyone's telling me to do just because they're telling me to do it. And, you know, they're the doctor, they're the surgeon, they're the pharmacist, whatever. I think even if you have a very good relationship with your team, you still need to be part of it, right? It's not just about doing whatever the doctors say. I think it's about doing your research, having like a mutual respect with your team. So they're not talking at you, you're having the conversation together, right? So for me, I found my experience and my relationship in general with cancer, with my doctors and everything, totally shifted when I took that approach, right? Like now, like my whole team knows, like if Jay calls, you better call him back because if not, he's going to be calling the next person and the next person until someone picks up the phone. But that's just because like I've been able to establish that over 5 years, right? And it didn't come out, and it took a long time, and I'm still learning. So a lot of the things that I encourage, and I think we're lacking actually in the system, is teaching patients to actually how to advocate for themselves, right? And yes, like, is the system perfect? No, no one's going to say it is, right? Every province is different. Every hospital is different. We know that there's gaps, there's issues. I'm not going to talk to that. But the one thing that we could do is empower the patients a little bit more to learn how to be essentially like a good patient and part of your team, right? And for me, that looks like, you know, not learning that it's okay to to ask your doctors questions and challenge them, right? And ask why, or I don't understand. I don't like that. That makes me nervous. What is your, what's your reasoning behind that? Can I have a second opinion? Can you talk to one of your colleagues for me? So I think it's really just understanding how to talk to your medical team, how to navigate the system, and become part of your team. That's really been, yes.
May I thank you for all of that
Yeah.
amazing information. Did reframing your cancer as a chronic disease, was that the moment at which some of the shifting happened for you, or what was your you talked about a shift. What was it specifically that may have really led to that? That would be helpful for others.
For sure. Well, my diagnosis wise, I guess, is a tad unique because so I got diagnosed at 36 with stage 3 colon cancer, and it was high risk. It went to quite a few lymph nodes. We did a surgery. I did 6 months of chemo. I was NED. I was squeaky clean for a couple of years. And then, unfortunately, a couple small nodules popped up in my lung. So my team was all over it. I was able to, I had a whole bunch of consults, second opinions. And because of my relationship with my team, I was able to essentially get SBRT. So I did like 30 minutes of treatment as opposed to like a major surgery. And I've been NED since. So it's been over a year now that I've been clear. So I'm on like 6 month scans now, which is wonderful. So for a lot of the beginning, like I didn't see it as a chronic illness because the game plan was like, oh, you're stage 3, we're going to do your treatment, you're going to be done, go back to your life. And then when the lung nodules popped up, obviously I know that means a stage 4 diagnosis. But again, my oncologist is phenomenal. He was like very clear that there's very different stage 4 situations, right? Like stage 4 at any stage, every person is unique. And I think that to me was the shift of when I said, okay, like regardless what this is or what stage it is, it's something I'm going to live with for the rest of my life, regardless if I'm NED playing whack-a-mole for a few, like whatever, right? Even at stage 3, it would have been the rest of my life as a young adult. Like it's not like 10 or 15 years of dealing with like potential side effects or, oh, maybe it'll come back, maybe it won't. It's like 40, right? It's like 40 years or like plus maybe. So the shift of I have to become friends with this and learn how to live with it, regardless what the status is or what's going on, was really the shift that's allowed me to kind of look at it very much like Lisa said, as like, okay, it's something that I'm living with. It's not this big, terminal thing that's happening to me and I'm going away next week, right?
Yeah, both of you, Lisa, Jason, are extraordinary in this. I wanted to bring Dr. Hannah and Dr. Nettie back into the conversation. Clearly, how a person thinks about, mentally deals with, addresses what they're facing can and does lead to better outcomes. Could both of you provide comments on that?
Sure, I can, if it's okay, Dr. Nettie, I can go first. I love Jay's comments about, learning to be a patient. It's such an important part of the discussion, and some of the best interactions, the most sort of successful interactions that I have with patients are when people feel comfortable to ask, to question, to challenge, to bring their own thoughts and ideas, because at the end of the day, you're the one who's living with this illness. You know yourself the best of all. I can make recommendations and suggestions, but at the end of the day, you have to be comfortable with this and to live with the suggestions that we make. They have to work for you. But to your question, Anne-Marie, I mean, the mental and the physical are so interconnected. You cannot separate out the two. Your head is attached to your body, no matter how you dress it up. And, we pay so much attention to the physical sides of cancer that I think it's only now that we're really starting to recognize the emotional stress and burden of a cancer diagnosis on a patient and on their family, and how it is equally important to support patients and their families emotionally, spiritually, psychologically, as it is to address their physical distress. And there's research to show that when people are depressed or, emotionally distressed, then they feel physical symptoms more as well, right? So everything is interconnected. And so it is crucially important that we are asking patients about and their families about their mental well-being, making sure that they have the supports that they need, offering supports in a timely manner when patients and their families need them, and really stepping up to that, and not just, focusing on physical sides of things, because you see it. It's night and day when patients are emotionally and families are emotionally supported and emotionally strong and doing well emotionally. They do so much better physically, and they're more able to engage, as Jay explained, in participating in their own care. It's an essential part of the conversation.
Yeah, beautifully said. Did you want to add to that, Dr. Nitty?
Well, it was a very complete answer, and I would just echo that absolutely essential. And in more recent years, we actually see, research and literature that supports this. So when folks are supported emotionally, they do physically better, and they live longer, and they live better longer. So when you actually look at cancer outcomes, you see benefits from that really fulsome support for both for folks navigating cancer and for their caregivers. We're seeing more and more, and this is more recent research on how it can affect caregiving, how it can affect their health, and how support that supports their health can diminish some of the chronic conditions and pieces that we see with caregivers. So it's just across the board of benefit. And I really appreciated both Lisa and Jay what you shared around what it means to be an activated, engaged, and empowered patient in our system. And again, the research there shows that when our system supports folks to get to that place of being that engaged patient, that they do better. So yes, I think, positive state of mind and feeling well supported, I think those are really important. And then I think there's just one more layer to it that we do see a lot within our programs and services, and we do a lot of group programs because I think talking about these really important areas of our health in groups, it normalizes it. Folks realize, like, I'm experiencing a lot of emotional distress, and that's normal. This is, what I'm going through is a really big deal, and there's a lot of layers that I need to work through. And what people will say is that there can be a real incredible pressure for folks to be positive. So I think that an important piece of this is when we say that a positive state of mind is good for somebody, it needs to be authentic. And oftentimes people need to get support and to get what they need to get there authentically. So that's just an added layer that comes up all the time in our programs that I thought
I'm very glad you brought that up, because it seems very intuitive to positive attitude, positive results, but easier said than done. And I think particularly in these circumstances. So in the couple of moments that we have left, I wanted to reach out to both Jay and Lisa with the same question. And knowing that your life continues to be filled with uncertainty and limitations, where do you actually source joy and purpose? And how could you share that in the context for others who may be in a very similar place to what you've been in?
Well, for myself, because I'm always mourning the fact that I can no longer plan ahead, that I can't plan to travel. I have treatment every 2 weeks, and that really puts a limit on what I can do. But over the years, I've just done my 50th treatment. I can schedule it, and I know how I'm going to feel on each day. And I just sort of think about it as, what if I was a university student and I was going to classes at certain times of day? So I just plan around it. And it was difficult at first, but now it's just my life. And I look at the calendar and I know when I can do things, and I can get joy around my treatment days. And all of my people know, oh, she's having treatment that day, she's going to feel lousy 2 or 3 days after. We're not going to plan our activity then. But it's manageable. And I wish I had known that at the beginning, and it's not the end of the world. You just plan around it just like a schedule of any other kind.
Mm-hmm. Normalize it as much as possible.
And toxic, like you were saying before, it's positivity is good, but Dr. Nettie was pointing out that you can't always be positive. So having people to sort of discuss the reality of it with, it helps you become more positive while talking about the lesser known things like the rage and the peripheral neuropathy and all the things that make us sad. You get over it and then you get used to it and it's normalized, like you said.
Thank you, Lisa. Thank you again for being here. Jay, you have the final word on this.
Oh boy, the pressure. No, I would say for me, very much like what Lisa said, like I noticed a big shift, and it was key for me to like accept that things are different, right? Like life is not going to go back to what it was prior to the diagnosis. Whether that be physical changes, emotional changes, planning, the uncertainty, like there's just so much that goes into a diagnosis that instead of fighting I want to go back to my old self, I want to go back to who I was 5 years ago. It's just kind of, I find once that acceptance happens that, okay, this is happening to me. Things are going to change. It's going to be different. And that's okay. And that could be day by day, week by week, hour by hour, depending what you have going on. I refuse to put limitations on myself, and I refuse to let, cancer be a reason for me not to be happy or not to do things or to skip out on things. I kind of took the reverse, the opposite approach to it is, I'm grateful for the experiences that I get to do, because when you're in this space for long enough, you start to meet a lot of people that do pass away and don't get to do things that they want to do, and don't get to experience life. So I think for me, it was the opposite. It's not to limit myself, go out, do the things I want to do, while accepting that, yes, it might not be exactly how it was 5 years ago. I might run a little slower, my feet might hurt a little more, or what have you, but adapt to that and learn how to overcome it and use your community and your support and just figure out new ways to do things that you love, just learning who you are now.
Right. Thank you for that. And for those of you who are listening, who are looking for community and support, certainly you can reach out to Colorectal Cancer Canada and they'll hook you up for sure. So again, thank you to Lisa, to Jay, to our wonderful two docs. We're going to go to a question period. I'm sure we're going to have many. With many thanks to all of you, we have a number of questions that have come through on this very important session, and Dr. Hannon, Dr. Nettie, Jay, and Lisa are all here to help us to get to as many questions as we possibly can. So I'm going to start with the very first one. And the question is, how can I manage ongoing fatigue and regain my strength after treatment? And I'm going to ask for Dr. Nettie to start us off on this one.
Certainly. So this will certainly look differently for everyone, different for everyone. But this is where a community of support that folks are connecting to through this conference can really make a difference. So we now have really good evidence that exercise, and certainly exercise that's right for you, that's tailored for you and appropriate, can make a huge difference to managing fatigue and regaining strength as well. And combining that with just that community of support that can give you, the social support, the mental health support, because we know that, fatigue can be not only a physical factor, but also an emotional factor. So getting connected to resources that can support you to, make some of those strides in those areas, and just knowing that you don't have to do that alone, that support is available to get started. It can be quite intimidating sometimes, but support is available for
Yes.
folks. Yeah.
Fantastic. I mean, Jay and Lisa, I'm sure you've both dealt with these, with those with those issues, perhaps you could share how you address them. Lisa, why don't you go first?
When I come home after the actual treatment, I just allow myself the time to rest. And I will budget to order in a meal or have pre-cooked my things so that I could just warm up a meal, knowing full well that I'm not interested in getting into the nitty gritty of chopping vegetables and cooking. And the other thing that I always do is the day before my treatments, I always clean my house. I always change my sheets and make sure it's all done before the really fatigue inducing things happen.
Beautiful proactivity.
Yeah.
Jay?
Yeah, I mean, very similar to I think I agree with definitely everything Lisa and Dr. Nettie was saying. I was able, very fortunately, to keep pretty active during my treatment. So I know that helped quite a bit for me personally. I'm about 4 years out from my last chemo treatment now, but I still definitely have fatigue, definitely more than prior to my diagnosis, and have some of that more of the long term effects going on at this point. But I know what really helped me was this is when I really kind of stepped outside of just looking at it as like chemo or cancer, and looking at it as like a whole collaborative team. And I really worked hard with my naturopath and like physiotherapy and my personal trainer. Like that's when I really pulled everybody together, with the same common goals to really get myself back to a level that I'd be happy with. And that community is huge. I mean, to just have that connection and learn about other resources and programs and everything that are out there is really critical as well.
Yeah, thank you so much for that. And just a reminder to everybody that, Colorectal Cancer Canada has a variety of uh, resources and certainly can guide you towards some of the resources that everyone is chatting about today. So never hesitate to reach out. I'm going to go to the next question, and I think there's two components to it. And Sarah writes, my first IV chemo treatment is on Tuesday, and I am terrified. So Sarah, I know everybody on this session wishes you well, but I think maybe we'll approach this from two perspectives, from a medical perspective and then from an emotional patient perspective. So Dr. Hannon, Dr. Nettie, would you like to comment on how Sarah can get herself comfortable for Tuesday, and then maybe Jay and Lisa same.
First of all, Sarah, best of luck next week. It's always really scary heading in for that first chemo appointment, and we're sending you all of our best wishes that it goes smoothly, and that you sail through. And I know Lisa and Jay will give you much better advice than me, so I'm not going to speak for too long. I think just being prepared, going there, plenty of time, bringing some reading materials, something cozy, because sometimes it can be cold when you're sitting around waiting. Make notes. I think, if your first chemotherapy, you don't know what to expect. And I always tell patients, you're going to learn from each chemotherapy session. You're going to learn the sort of the rhythm of the chemo center and what happens. So make notes. If somebody can come with you, just to be there, I think that would be super helpful. And don't forget to ask, the doctors and the nurses who are there to answer your questions. They'll talk you through everything that's going to happen. And the more questions you ask, the more empowered you feel, the more calm you feel, the more in control you feel. And there's no such thing as stupid questions or too many questions. Everybody wants to support you. So please bring all of your questions, and I'm sure they will get answered for you. But I'm sure, Lisa, Jay, you guys probably have much better suggestions than I.
I would just keep it in the forefront of your mind that ultimately the goal of treatment is to help you, to save you. And yeah, there are days when it's going to make you feel a little sick, but at the end, it's going to make you feel better. And supportive care is all around you. Mention every side effect to your team. They will help you. And never be afraid to ask those questions, like Dr. Hannon said, and never be afraid to mention, hey, it's kind of weird. I had this thing pop up. Tell me about that. The pharmacist will probably visit with you on your first chemotherapy as well, and you can ask them all the questions about side effects. And make use of that time that they're going to offer you at your first chemo.
Jay, I'll let you have a final word on this question.
Oh my goodness, yeah, I could just say when that question came through, it was definitely goosebumps. For me particularly, because I had surgery up front, and then I found out I needed chemotherapy afterwards. And that first time going into the chemo unit, that's when kind of things got very real for me, right? Like that this was cancer, not just a surgery. So I definitely very much understand the fear and the nerves and everything. Everyone's given great advice. Um, there's not a lot to add really. Everyone gave some really good advice, except for um, you're gonna get into a rhythm. Like give yourself 2 or 3 cycles, um, and then you're gonna kind of go in there and you're gonna know exactly what's happening. Like the fear of the unknown is absolutely kind of forefront, I can imagine, because it was for me. But once you go in, you see it, you understand how things flow. You're going to be going in eventually in like 2 or 3 rounds from now, and you're going to have stuff ready for the nurses. You're going to be saying, nope, nope, like there'll be a new nurse on the unit, and you'll be like, nope, this comes first, right? Like you're going to turn into a pro, almost into like a professional patient, sort of speak. Um, but just I think the biggest one is, yeah, tell your team everything, anything you feel, anything you're worried about. If you don't understand something, tell them you don't understand it and ask for a different explanation. My oncologist kind of explained it to me that there's nothing fun about chemo. It's a very scary experience, but the team's job is to make sure that you can go through it as easily as possible, even though it's going to be hard. But their job is to make sure you're as comfortable as possible. And for them to be able to do that, you need to tell them stuff. So, so tell them as much as possible.
Thank you so much, everyone. And Sarah, best wishes to you on Tuesday. I'm going to go to the next question here. It's a long one, but it's really under the general premise of essentially the theme of this session, which is really navigating life with cancer. So here's the question. I have only recently been diagnosed with colon cancer and have had surgery in the past month. I'll meet the surgeon for follow-up next week, so I don't yet know what treatment I may need, and if I do, how I'm going to feel. I'm wondering how it's possible to plan for work. I teach university classes, and the plan is to start again in the fall, which has to be scheduled now. I'm assuming each person feels differently depending on a number of factors, including the treatment itself. So really, this is the idea of not knowing how to necessarily plan or navigate when there's a lot of uncertainty ahead of you, particularly related to the management of your life. Does somebody want to start the conversation with some thoughts on how we can address the issues this person is mulling around?
I can certainly just jump in and just say I certainly don't have all the answers, but I think that the questions that you're asking are so incredibly relevant and are going to be what leads you down the path of being as informed as possible. So the surgeon, hopefully in that follow-up visit, can provide some even just basic parameters around what might be coming next, and is there going to be an upcoming conversation with an oncologist and that sort of thing, and hopefully that timeline can be fairly short. I know that one of the things that as a physician at Inspire Health that it's not uncommon for me to be having conversations with folks during this stage to say these are some of the potential paths for treatment, and what does that look like from a timeline perspective, what does that look like from a return to work perspective, and so there might be a role also for a family physician to be playing a role here as well, with providing some information about what the options may be given the particulars of your cancer.
Mm-hmm. Mm-hmm. Lisa J., Dr. Nettie, would you like to comment at all?
I think what you've experienced so early in your course of treatment is going to be your new normal, is not knowing what is ahead. And getting used to that and knowing that you have to make choices now without all of the information. Like you said, you have to sort of let them know if you're coming back to work in September now. My advice would be, if you have a good short-term disability plan with your employer, use it. It'll just take a lot of stress off, unless you think that the financial stress might be worse. So I appreciated not having to go to work so that I didn't have to feel sick at work and force myself to put on a public facing, you know, persona when I wasn't feeling my greatest. But the offset of that is financial. So these are some of the considerations you might want to make.
Yeah, I can think of no better way to end this Q&A. I'm so sorry, our time together, and there's still lots of questions here. For those of you who did ask questions, please know that Colorectal Cancer Canada will reach out to you to ensure that you've got all of the answers that you need to make yourself feel comfortable. In the meantime, many, many thanks to Dr. Hannon, Dr. Nettie, to Lisa and Jay, as always, for participating today and for the rest of the session.
Thank you.
Thank you.
Thank you.